Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about celiac disease in baby. Celiac disease is an allergy triggered by gluten. The body is unable to break down gluten found in some grains, including wheat, barley, oats, and rye. This causes the immune system to attack the intestines so the body can't absorb nutrients. If left untreated, it can cause malnourishment. The condition is hereditary and occurs more often in females. In a family with a history of celiac disease, 10% of family members may have the problem. About 1 in 100 people suffer from it. Celiac disease is difficult to diagnose. The problem can occur any time from infancy on. It usually occurs when a baby begins eating cereal and bread. In babies, the most common symptom may be irritability. Other symptoms of celiac disease can include weight loss or slow weight gain after adding cereal to her diet, a bloated stomach, shrunken arms and legs, vomiting, poor appetite, diarrhea, pale or foul-smelling stools, frequent gas, abdominal pain, mouth ulcers, pale skin color, bleeding easily, and a failure to thrive. We once believed babies outgrow celiac disease, but we now know this is not true. Some symptoms may subside, such as cramping, gas, and diarrhea, but if left untreated, celiac disease can be harmful to your child. Your child's growth may suffer and neurological problems may arise. Celiac disease usually first appears after baby starts solids. Baby cereal is the culprit because most is made from wheat, oats, barley, or rye. If baby has many of the above symptoms and there's a family history of the problem, let your pediatrician know. If you suspect baby may have celiac disease, monitor her diet. Note any changes you see as you introduce new foods. One study showed the risk of celiac disease was reduced if baby continued breastfeeding when she began solid foods that contained gluten. If symptoms don't decrease within 3 weeks of changing baby's diet, your pediatrician will probably want to see her. A blood test may help determine the presence of celiac. A biopsy of the small intestine can confirm it. It can be serious if your baby doesn't regain lost weight or if she fails to grow and develop as expected. A child diagnosed with celiac disease will have to eliminate gluten from her diet and will have to remain on this diet for the rest of her life. Your doctor will assess the situation and offer a course of treatment. Vitamins may be necessary because your child will not be able to get many needed vitamins, such as folic acid, from the food she eats. Your doctor may also prescribe oral cortisone drugs to reduce baby's inflammatory response during a severe attack. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many subjects dealing with baby in a weekly format. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It lists topics about baby covered in our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and other important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.